The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and welcome to SSHP's September quarterly webinar for student societies. My name is Gina Luchin. I'm Director of Academic Programs, and today we will be discussing a topic that has been top of mind for many of you, which is virtual recruitment, virtual events during the pandemic. So in the next few slides, we'll go through some examples and some best practices that we've gathered, and then also answer any questions you guys may have. For those of you that have been in a webinar before, you know there's a question box at the bottom of your screen and control panel. Feel free to engage with us throughout the webinar, and we'd be happy to answer questions. Additionally, this webinar will be recorded, and a link will be sent out to you with your monthly updates, as well as following the webinar in your email address that you've signed up. So with that, we'll get started. And again, feel free to drop your questions as they come up throughout the webinar. So a few things that we'll cover today, as we mentioned, will be the ASHP, SSHP recognition process and some of the virtual events and planning that we've seen and recognized that hopefully will help you in your planning for the next year. And also some questions we've received about the graduation course program and how that should be implemented given the virtual environment. So we'll cover all those things today. To start, many of your SSHPs will have already received notification, but the ASHP SSHP recognition program has been issued for 2020-2021. So recognized student societies should have received an email acknowledging and congratulating you for the amazing accomplishment of achieving recognition for yet another year. For those of you that are new, welcome to the program, and we hope to continue to collaborate with you in the coming years. But we wanted to kind of briefly touch base on the questions that come up and kind of address different things that you may be wondering. First off, the requirements are the same for 2021-2022, but we wanted to kind of reiterate them for everyone's understanding and a couple different changes and leniencies that have come up as a result of COVID-19. So the first one was the membership drive. So everyone should be conducting a membership drive similar to how we've done in past years, realizing that this is a virtual environment. It does not have to be in person. So for those of you with a hybrid or fully virtual learning process, I think online drives will satisfy this requirement. For those of you who may not have seen last time or may not have seen the webinar, the July webinar that we did for student societies, ASHP is offering a P1 free membership to all students. And so we ask that you do incorporate that as part of your virtual planning. And for those schools that are interested in enrolling the entire cohort for their P1s, we're happy to just process those rosters for you and do it automatically so that all your colleagues are able to take advantage of this program. The other requirement that is multifold is the career development project. So the first requirement is the clinical skills competition, and I see that our first question is in about the cases. So cases have been sent to all the representatives who have been indicated from each school as the designated individual for the clinical skills competition. So all those materials were sent to the individual that we have on record. If you have not received your content, then email us at students@ashp.org, and we'd be happy to share that content with you. But everyone should have received it by now. The faculty coordinators for each school should have received it. One change that we are going to be seeing for 2020, obviously with virtual mid-year clinical meeting, we are going to have a virtual clinical skills competition that will be held on a national level. More information will be shared with the schools and the individuals that will be participating. And then also for those of you who are organizing a local clinical skills competition to fulfill that requirement, we do want to make sure that you understand that there are flexibilities with how you are able to conduct this. We do not place specific restrictions, but we do have the link to help you with some best practices. So if you click on this blue link here on your handout that is shared through the screen, you'll be able to see the online clinical skills competition page and some of the updated leniencies that we have provided for 2021, and then also the best practices guide that will help you identify different ways you could be conducting your clinical skills competition this year. Other events and other requirements for recognition are the health system speakers. Again, this is something that can happen virtually or in person, residency information session, and then well-being and resilience. We did note that, I see one of the questions here, the requirements have not changed for 2021, 2022. There was an error in the original email we sent for the congratulatory email with an attachment from last year. So please disregard that. We will be issuing an update. The Wellbeing and Resilience Program will continue to be an part of career development, and you will still have the flexibility to conduct whatever event is most creative, comfortable, and innovative for your society as a professional development event. So just to repeat that for everyone, the Wellbeing and Resilience event is not required as your only professional development project. It falls under the career development category instead. So you are free to do whatever project you wish as long as it aligns with the strategic goals of ASHP for your professional development project. So we apologize for that mistake, but we're issuing a correction so you have the correct PDF. The webpage has the correct information, so feel free to refer to our website for the most current program details. Additional requirements that we tend to see are the incorporation of PI 2030 in at least one of your activities, and that could be any of the categories above. We also have best practices documents and a full student page on PAI 2030 that you can access online. So the student resource page includes some background on PAI, the history of PAI 2030, and then what your school at SSHP can do in order to satisfy this requirement and help spread the word for practice advancement. And then also we do require state affiliate collaboration. And one question that we commonly get is, what does that mean? So depending on your school, you may have a different level of engagement with your state affiliate. And we definitely encourage all as much engagement as possible. So it could be as simple as your state affiliate speakers, as simple as your health system speakers being state affiliate representatives, or you working and coordinating with them for your residency information event or well-being initiative. We've had some SSHPs collaborate with their state affiliate on poster presentations and also participate in their annual state events. And so feel free to collaborate with them on any of the on any of those ways. They're all certainly acceptable. As long as you denote what that collaboration is, we will take that into consideration. And of course, another question that comes up a lot is, what happens if I'm unable to satisfy the recognition requirements next year, considering COVID-19 does not allow us to fully execute and engage with our student societies as we've wanted to in the past? So that's a great question. And what we recommend is that you try and accomplish as many of the requirements as possible for recognition. And then for those that you're unable to meet, we ask you to note that on next year's application, stating that due to COVID-19, we were unable to fulfill and satisfy this requirement. What we've seen and we enjoyed in the past is, if you did have a program planned, note that and say, this is what we had planned, we weren't able to complete it, so that we know that there was some planning done or that you had thought ahead. But we certainly will not penalize you for going all virtual or unable to meeting some of those requirements. That includes the clinical skills competition. So we do encourage everyone to conduct it, but realizing that technology may be limited for some of you, we will take that into consideration as well. So I don't see any more questions right now for recognition, but please keep them coming. I know this is a new change, and virtual environments make this a little bit more challenging than we would all have hoped for, but we're definitely here for you, and as things change, we'll continue to update you. So I'll pause for a moment and allow you guys to ask any questions, and then we'll move on to the next topic. All right, I don't see any more questions for us. So we'll continue to move on with our next, but feel free to keep checking our webpage, and again, contact us at our students at ashp.org should anything additional come up, and we'd be happy to address that as well. Oh, there's one question that just came up. No PAI video competition. Good question. So the PAI video competition was discontinued last year. With the shift to PAI 2030, we actually have changed that platform a little bit. So your student society is still required to perform an event related to PAI 2030, the Practice Advancement Initiative, but we are no longer holding the competition. When you do visit the PAI 2030 webpage for students, there is a student resource page, and then there's one tab that's called Share Your Advancement Initiative. We do request and ask that if your SSHP is looking for ideas on what to do or has creative ideas on how we can spread the message and share with students the Practice Advancement Initiative, you submit it through that platform. It's not a competition similar to what it was before, but what we're doing is we're selecting entries, whether it's videos, blogs, vlogs, activities, or any other descriptors and handouts. We're collecting those and post them on the website. So if your SSHP is wanting to submit a resource, we'd be happy to review it and then feature it and highlight it on our page. So no video competition, but we do have other media and communication methods. So thank you for that question. All right, now let's move on to some of the virtual engagements. I know this is something that has come up time and time again. We realize that the times have changed and it's challenging to come up and brainstorm ideas on what to do for a virtual platform. So what we've done is we've reviewed some of the recognition applications and seen some of the wonderful work you guys have done. And hope to showcase that today so that you can get some ideas and get the creative ideas flowing so that we can get more and more events on the virtual platform and engage your members so you can continue to have active membership. So we do have 136 programs that have been recognized officially by ASHP this year. If your SSHP did not receive recognition or did not receive communication about it, please email us and we'll take care of it to review your application or talk about your situation. And there were 46 virtual events that have been conducted by SSHP. So this was really encouraging to see. We were very impressed with a lot of the applications we reviewed. So today we've compiled a few that we thought really hit the ball and it really just displayed ASHP's vision, and met all the requirements, and we're really creative on the virtual platform that we wanted to share with you. So some of them that we'll hit on today are about virtual speakers, some panels that we've seen. There's a virtual symposium that one of the SSHPs put together, webinar series, educational campaigns, and then a lot of social media engagement. I am sure that your SSHPs will continue to impress us throughout the year and for next year's applications, but we just wanted to spark some ideas as you're thinking and planning ahead. So what we're going to do is take this through similar to how categories are and requirements are in place for recognition, and hopefully you guys can take notes on some of the areas that may be of particular interest or struggle for you. All right, so first off, we wanted to highlight 3 schools on what they've done for residency information. So the first one was the Southwestern Oklahoma State University College of Pharmacy. And what they conducted was a residency panel. So basically, typically they have a panel that is in person, and for this year they decided to do a virtual platform where they had discussion on day-to-day pharmacy resident activities. They discussed residency programs and what are the details of the application process, interviewing process, and getting to discuss with residents going through the experience themselves. We're highlighting this because this is a great opportunity to take already existing events you would have in person and transition them over to a virtual platform. Many of the schools have used their school's virtual platform, whether that be Zoom that they have a license for, whether that be Blackboard that they have a license for, so working with the actual school administration to get this, or if your SSHP already has a platform to use. And ASHP developed a guide. The most commonly utilized one is Zoom. So we developed a quick guide that we've posted on ASHP Connect about how to best utilize Zoom for your student society. So you can take a look at that and see if there's any tips and tricks you can learn. But a panel was one of the ideas that were described and we wanted to highlight. Then we had Presbyterian College School of Pharmacy, and they conducted a virtual residency week. So this was a daily panel that they conducted every day. They had a different topic, and they covered CV development, they covered postgraduate training, they covered interviewing techniques, and then on the very last day, they had a residency preceptor, a residency director panel that was talking about advice and personal experience on what applications they've seen, how they're seeing change in their application process, and lots of things like that. So again, this was an example of taking instead of doing a 5-hour event virtually, we felt this really represented the idea that as you guys are looking for virtual events that engage students, trying to break it up into small bite-sized content pieces that people feel more comfortable joining. So you may drag it out to a week, or you may want to do something every other week, or you may want to incorporate it in some of your evenings. So as you're thinking about activities for your SSHP, try to think of engaging them not only in a one-day event, but really spreading it out too to maximize your engagement. Lastly, we had Manchester University College of Pharmacy, and they had a P4 panel on those that recently matched their residency program. So really fresh ideas on what they just went through, how they became successful while it's still on their mind. So they presented the process of residency application, talking about mid-year, and then what to expect for interviews. So those were, we felt, 3 really good examples on how you can tackle this residency information requirement. And what you can do to help ease the anxiety for your colleagues as they still want to engage with residents, they still want to engage with programs, and you can serve as that platform to help facilitate that. So I'll give everyone a moment to pause and see if you have any questions on the 3 events, or if you wanted to share in the question box, if you wanted to share something your SSHP did that may help others on this webinar. All right, I don't see questions yet, but keep them flowing as they come up. All right, one more residency activity that was really impressive was the University of Arkansas Medical Sciences College of Pharmacy. So we've broken it down into what they used to do and what they've kind of transitioned over to a virtual platform, just because their event was a little bit more robust. So typically what they would do is they would have a dinner with students, incoming residents, and outgoing residents. So they had this networking in-person event engaging everybody. And then they also had multi-state involvement, representation, so and guest speakers. So this was a whole day, whole evening event where they had the networking piece, they had the multiple programs representing and providing a panel, and then answering questions about their program. And so what they did was they took that and transitioned it over to a virtual platform. And so they selected guest speakers from past events and the ones that were most interested. They actually submitted a poll of students to see what would be best fitting their interest and what they were most struggling with and what programs they'd be more interested in seeing. And they had Q&A, a live Q&A session with some pre-submitted questions from the student poll they did, and some of them that kind of came up on the spot. So this was a great opportunity to engage students virtually again, and providing that networking experience, even if they didn't have that in-person component. Obviously, there were some differences in the event being smaller than anticipated, smaller than the in-person event, considering they couldn't have as many speakers or as many networking opportunities for students, but they did follow up with email, and they also did do more detailed discussions, allowing that one-on-one contact. So students did have the opportunity to then connect with each of the speakers afterwards via email and then via chat, so they continue that networking opportunity. So that's just another way you can turn your in-person event into a virtual experience or a virtual panel. And we did just get a question. So we're struggling getting students engaged in the organization virtually. So asking if there's any events that include any events, including recruitment events, so how we can get more students engaged. So that's a great question. A lot of times, what we see is that SSHPs that are being successful in recruiting people for these events really choose high impact topics and high impact presenters to really gauge the interest of the students. Sometimes they utilize listservs that are available in the school just to promote their event, but also really, topics around residency or around career development, professional development tend to be of interest. And also we're seeing that events in the evening are actually more successful than events during the day, as students may be seeking that social opportunity, especially for those that are still quarantined and not really engaging with socially with others very much. This is a good opportunity for them to connect. Of course, there are opportunities for some SSHPs conducting giveaways and really kind of enticing students in that regard. But we're seeing that trying to place your event in the evening, choosing topics that are high impact and high interest, and then often engaging students too in the selection of the topics may help. So if they have a say in what the presentation or what the order or what the content would be, that tends to be a little bit more successful than otherwise. And then, if you are able to have them participate in a way, whether that would be with the live Q&A or have a hands-on activity, that also helps with the engagement piece of that, so that they feel like they're participating rather than just being spoken to. And then well-being and resilience. So this is another one that I think we've had some creative ideas, I think, throughout the past couple of years. And the virtual platform has really helped us elevate this a little bit. We saw some really, really unique things that took place virtually that you might be interested for your SSHP. So the first one was the University of California, San Diego Skaggs School of Pharmacy and Pharmaceutical Sciences. This one, I think, kind of ties back to the previous example. They had over 100 participants, and I think the success of this event was really back to how they engaged the students. And so this is, I guess, a good lesson learned as far as engagement. So what they did was they focused on providing students with mental and physical strategies to maintain their mental health through COVID-19, and they approached it in a three-part approach. So first, they had a clinical psychologist that engaged with them on mental health during this time. So they talked about coping strategies. They talked about connection to the community. They talked about isolation, so really recognizing the issue and recognizing the concern that a lot of students had. They also worked with their school on that first part to identify student counseling resources and mental health and well-being resources that could refer students to. So for those students that were struggling, they really just provided an opportunity to beyond just the SSHP presentation to help out. So that was a very creative part one. What they did then was that they surveyed students and faculty on how they were maintaining their mental health during quarantine. So just examples, and they submitted video snippets and photographs, what they're doing to staying active, what they're doing to kind of avoid isolation, creative ways that they're engaging. So again, this is the engagement part with them. They asked them to contribute something from their daily life. And then the third part was the video entries that they combined. They highlighted them, and they kind of created a video and a presentation on all the different aspects that had been submitted and really sharing with each other, so creating a sense of community and created a sense of networking. So this was a great example, we felt, of starting with the presentation and really delivering the content, engaging the school, providing students resources beyond that presentation, and then really engaging to see what everyone else was doing and exchanging information. So again, the participants, they had over 100 participants and they engaged both students and faculty. So that was also a really unique way to engage. So for those of you interested, I think that may be a good one to consider. And then also they did promote interdisciplinary collaboration for both phases. So they engaged not only student pharmacists, but also medical pharmacists, medical professionals, sorry. Student physicians in this process. So this was really kind of encompassing a number of different activities and a number of different goals that ASHP has. So a good one to consider. So I'll give you a moment to kind of absorb this, and then we'll move on to the next one. And then I'm also watching the question queue if anything else comes up. All right, so a little different approach from Nova Southeastern University College of Pharmacy, again, on well-being and resilience. So they conducted a virtual series, and this was a number of different approaches to well-being. It wasn't your traditional presentation. They also had some other creative aspects they incorporated that we wanted to bring up. So first off, they did weekly emails with tips on well-being and resilience. So what are tips on how to stay healthy, how to stay active, tips and tricks on how to prevent isolation and online networking and things like that. Then they provided reminders about a meditation app, and so kind of encouraging students to be mindful of their health and well-being. And just as a reminder, for those of you that have ASHP membership, we do have a free subscription to Headspace, which is a meditation app. So for those of you that are members, please take advantage of this for free, and you can also incorporate it as part of your online recruitment or as part of your online activities. This is just an additional step that you could do just to break the routine and help focus on your well-being. The third that they did was they provided informational handouts, some of them from ASHP's Wellbeing and Resilience website. So if you haven't had a chance to visit that, please do so. It's called ASHP Wellbeing and You. So this will have tips and tricks. Some of them are actually well-being on how to stay healthy in your work environment and at home. So a lot of good content. And then they also engaged in podcasts, sharing podcasts that ASHP had conducted, but also kind of doing their own interviews within the school and really sharing their experiences. So always feel free to engage with any of the content we have available. We felt this was really creative and in a multi-approach level. So utilizing the emails, utilizing the podcasts, utilizing handouts, so something for everyone there. And then lastly, they shared virtual art exhibits. So their city had, and their state had some virtual art exhibits that students took a note of. And so really just providing an additional opportunity for engagement outside of the traditional walls of the school and the SSHP engagement. So very, very creative, again, multifaceted approach to the well-being event. Obviously, you can take this and adapt it any way, but we felt it was good to highlight it. So again, I'll give you a minute to look at it and look up the ASHP webpage if you haven't on ASHP Wellbeing and You. All right, next we have Southeastern Oklahoma State University College of Pharmacy. So they did something similar to what we've discussed before, where students and faculty send in pictures and tips on how they coped with the stress. So they could either submit a photo of how they practice self-care, or submit a photo to show how the students helped each other and how the community helped them mitigate the effects of COVID. And then also they could send information about promoting mental health or tips, any classes or any resources that they had come across. And then they took that together and they packaged it and sent it back to everyone with kind of snippets of this week we learned this week we learned that. So this was really interesting. Again, back to the point of how to engage students. This was a great way of asking them to create some content for you and then displaying that content. They feel like their content's highlighted and they also have an opportunity to engage. So this was really, really successful, again, because both students and faculty felt they could contribute. So the more you can do to get their feedback, to get their collaboration, I think we've seen that those tend to be more successful events overall. All right, so the next part of this is the professional development project. And before I dive into this, I just want to remind everyone that the professional development project could be anything. So we'll go through some creative ideas, but I don't want you to feel like this is the only topic you can cover. So again, professional development could be any initiative related to ASHP strategic goal. I know there's been a lot of confusion around this, so don't be afraid to kind of think outside the box. As long as you're within ASHP's mission and vision, you're good to go on this project. Another question we get very frequently is if the professional development project has to be a completely different project from your career development events. And this is a tricky question. Technically, we would prefer that every event is separate and the professional development event is its own. However, we do realize that some schools really go above and beyond with one of the activities. For example, if you're planning a multi-week event for well-being and resilience with multiple facets, we are willing to accept this as also your professional development project, realizing that it's more than just one event. It is really, you're taking this and applying it to the whole year, or you're taking a whole month. So we are flexible in that. If you have conducted an event that's really above and beyond, we are happy to incorporate that as part of your professional development as well. But typically we ask that they're separate events if possible. Okay, so this is a very interesting and innovative project that the University of Hawaii College of Pharmacy did. And so this was an alumni webinar series. We don't really see a lot of alumni events, and so this was really, I think, encouraging to see that you're engaging students after they've graduated to really help coach your current members. So part one was a postgraduate year panel. Similar to what other residency panels have been, they featured alumni who have gone through a PGY1, a PGY2, and kind of sharing their experience as a resident. So this was kind of their residency requirement as well, being folded in. Then they held a second series on where they are now, so looking at alumni that have completed their schooling, they've completed their residency and postgraduate trainings, and have done something unique in a sector that we don't typically hear much about. For example, the Division of Veterans Affairs, U.S. Public Health Service, community pharmacy events. They also had some non-traditional career pathways like veterinary pharmacy, and really just showed, where are you now? What is life after graduation? And then the third was a panel again on presentations on what they called it as Mission Impossible Professional Presentations and the Road Ahead. So this was a workshop on navigating a research project. So again, this is a little non-traditional from your typical topics that we've seen, but they helped coach students on how do you start a research project, how do you approach faculty, what does research look like, what would be a typical timeline, incorporating resources like ASHP's Research Resource Center to guide students on where they can start and what they can do from there. So again, very interesting hands-on approach, and it really incorporated the postgraduate training piece and residency preparation, what happens after graduation, and engaging that career development and professional exploration. And then third, really helping them with kind of top of mind issues like research and how you can help them. So a very creative three-part approach there from the University of Hawaii. Next, we had Sullivan University College of Pharmacy, and they conducted a virtual CV workshop that was open to everyone in their SSHP. This specific workshop was held via Blackboard Collaborate, and I know some of your schools may have access to that platform, so a good one to explore if you have not already. And they held that in collaboration with the actual school administration. And so this was really interesting because they engaged with faculty within their school and really allowed for a networking opportunity beyond just extracurricular involvement. We all know that during COVID, it's especially hard to get in touch with faculty and find a mentor. So this facilitated that for them. So what they did was they did breakout rooms, and each student would tell them where they were in their CV development. So for example, if you're a P1 student, you're still really haven't started. And so that was kind of the introductory piece. You had some that had started, but they weren't quite sure where to go next. And then you had some that had polished it and were just looking for a review. So they broke it down to rooms based on where they were at in the process. They had a faculty facilitator for each room. And so they provided real-time feedback and a small presentation before on kind of best practices and what you should do, what you should be looking for. And then they also provided the opportunity to connect following the event for those that were interested, especially for those folks that had already done a review program. So this would be a really good platform for your school, especially to engage that networking piece with faculty, which many schools are struggling with right now. But thinking about additional resources that ASHP is providing with regards to CV development, and when you're planning something like that, feel free to use our resources as well. ASHP has an entire CV development resource center, so you can go on and see sample CVs for each stage, what elements should be incorporated, some of the rubrics for guiding you on what you should include, and then of course ASHP CV review program. So if you're unable to do that piece, we are happy to do that for you. So again, a lot of resources that you can utilize existing information for. You don't have to recreate the wheel. Lean on ASHP and the resources that we provide, and then also engage your faculty and the local administrative piece so that you can encourage the opportunity for students to engage and really feel like they have that mentorship component. So again, I'll pause here and see if you haven't already, just Google ASHP CV development resources, and then also take a look at Sullivan University's work. All right, so PAI 2030 came up earlier, so this might be a good opportunity to kind of go through some ideas that schools have had with regards to this initiative. So the University of California did a PAI 2030 workshop that was virtual, utilizing Zoom breakout rooms. So in the past, they've been doing roundtables, and so this year they converted their physical roundtables into virtual roundtables and broke it down to Zoom breakout rooms. So they had 3 different stations. One of them focused on emerging technologies, one of them on inpatient acute care, and then ambulatory care. So each of those rooms focused on a different topic and a different discussion. So they had an expert that led a conversation about the state of practice in that particular area, and then they led a Q&A and also facilitated a discussion with some pre-planted questions and also some questions that kind of came up during the conversation. And then students had a chance to rotate through each of the virtual roundtables and talk with all of the different experts throughout the event. And so this was, again, very interesting because not only did they incorporate PAI, but they also brought in the COVID-19 impact. And so the experts were able to talk about not only the state of practice, but also how COVID has impacted the way that they're conducting clinical care or the way that administrative responsibilities are delegated and things like that. So very, very interesting way of folding in PAI, the different domains, but also educating students and providing a hands-on and realistic approach to what practice looks like today. One thing that we keep noting in the applications that we wanted to bring up for this webinar is that we used to have, PAI used to have the different pillars, the PAI pillars, but we have switched to the PAI 2030 domains. And so make sure that you're looking at the webpage that I provided earlier, because that is the most updated information instead of looking at the old initiative. So just ensure that your discussions are centered around the correct initiative. All right, with that, we were going to transition to graduation course, but before I start diving into that, I wanted to, again, pause and see if anyone had any questions regarding the virtual events, if there's something you wanted to share, or if there's any additional struggles that you wanted us to address today. All right, I'll keep checking the queue for anything that comes up. Keep in mind that one of our advisor groups this year with the Pharmacy Student Forum is actively working on a guide. So a lot of what we saw in the presentation today, again, we're developing some best practices for virtual events, and you should be getting that in the next month or 2. So just something to look for. And if you do have ideas that you want to share, and maybe some that didn't make it to the recognition packet you submitted, but you'd still feel would be worth highlighting, feel free to message us and we'd be happy to take that and fold it into our resources. We're happy to see all the innovative ideas and thinking that you guys have. So everybody has done really an excellent job adapting, especially considering how quickly things have changed. All right, so last but not least, we have the graduation cord program. Again, a lot of questions that we've received on this, and we just wanted to provide some clarity and help address this on a more comprehensive level. So first of all, the graduation cords program, as you may know, is a program that was created by ASHP to kind of assist your SSHPs to reward students that have been highly involved throughout the year. What happens is ASHP sets the eligibility requirements, or at least kind of a template of eligibility requirements, and you can find that online on our webpage. So typically they're around membership, local, state, and national participation, residency preparation, and leadership. Really, whatever you see on the recognition is kind of translated on the individual level for students to encourage not only membership, but active membership and participation. This is really part of the engagement piece. And then SSHPs will take the criteria that ASHP has provided, and they may need to make modifications. For example, if, let's say, your SSHP does not hold an annual event of sorts that is able to meet the criteria, or let's say your state affiliate is further away and maybe participation on a state level involvement may not be likely, then you're welcome to kind of modify that slightly. Just to fit your specific criteria. And then they also, we provide an option of limiting the number of graduation cords that are awarded. So some SSHPs choose to provide that to all their active members and kind of make their eligibility requirements so that they're able to, and other SSHPs really kind of limit the folks that are able to get the cords. This is SSHP specific, and again, it depends on the number of activities and how robust your programs have been throughout the year. And then the last piece is really implementing the program. So taking the criteria, finalizing them, and then monitoring what students have done that, what students have met the requirements, and then ordering the regalia. So this part, we provide a vendor online and we kind of provide all the instructions on how to do so, but ASHP does not order them for you. And that's a question that comes up often. Your SSHP is responsible for collecting the names, payment, and also doing the online ordering process, but we have worked with a vendor to provide the information for you. So really you just follow the step-by-step process and you're able to implement it. So you do have quite a bit of flexibility. And obviously with COVID-19, we've received a lot of questions as to how does the pandemic affect the program. So as with everything, we want to ensure that there's flexibility and that we remain understanding that students may not be able to fulfill all their requirements. So if your requirement has, for example, attend 6 residency events, but then your SSHP did not hold enough events to really meet that criteria, we ask that you apply leniency. So take a look at the criteria at your SSHP, ensure they're still relevant. And then another question we've been getting is, can you substitute an in-person program with a virtual program? And yes, the answer is of course yes. If your SSHP conducted a virtual event versus an in-person event, of course this is the substitute for meeting that criteria. So do not be concerned with making those alterations. We are happy to adapt, and we understand that changes need to be made to ensure that everyone has a fair chance. We don't want this to be unattainable, but we do want to reward those individuals that are staying engaged and have been engaged for a number of years with you and with us. So this is really an award. It's not a punishment. So feel free to adapt it as the times require. I know we may continue to get questions, but feel free to drop any with regards to graduation course program or regards to anything else. And that is all we had for you today. We just wanted to leave some time for questions and see if there's any additional information you wanted us to provide with regards to virtual events, the graduation program, or anything like that. While everyone's thinking, don't forget that the handout is provided in your chat, and so you should be able to download the slides and be able to get to the links that we've referenced throughout the presentation. The web recording is typically available within a day or two, and we will we will provide a link. So you will receive an email after this recording that should include the link to it, and then also your news link, the monthly news link you receive in the first of the month, and then the liaison update should have the link as well. So typically we upload them within a few days, so you should have access to that. All right, with that said, oh, there's one more. Are there any SSHPs willing to share their core program requirements? That's a good question. So this is a great idea to just exchange what SSHPs are doing. What we can do is I can start a connect thread for this, and then as SSHPs are comfortable sharing their best practices and what they're doing with their requirements, we can add that there. Yep, we'll do that through connect. Feel free to start with what we have on ASHP, because it does kind of provide the skeleton, but I think it's a good idea to see what others are doing and kind of collect all that together. Great thoughts. Anything else? All right. Well, thank you so much for joining us today. I appreciate everyone being here and supportive of the webinars. As always, please feel free to fill out the questions at the end of the webinar just to see if there's topics you'd like for us to be addressing in the future. And I did want to let you know that we are going to be replacing the November-December webinar with information about the virtual showcase in mid-year, so be on the lookout for that. So we will not hold an official SSHP webinar, but we'll do more of a student-wide webinar to assist you guys as virtual mid-years is really coming up and registration is officially open. So thank you all for joining us, and I hope you have a great rest of your day.